welcome to today's discussion on pressure points, the hidden dangers of high blood pressure. I am Richa Jain Kalra. Did you know that 1 out of every 4 adults in India are affected by a silent killer called high blood pressure? The shocking fact is that around 60% of those affected by it are not even aware of it. Common knowledge is that high BP affects our heart, but it has a wider impact on our body. That includes our brain, our kidneys, and even our eyes. To discuss this vital issue, I have an esteemed panel of doctors today to understand how we can detect high BP early and control it to have a healthier life. I'd like to welcome our experts on the panel today, Dr. Ashish Agrawal, Director Cardiology, Akash Super Speciality Hospital, Dwarka, New Delhi. Dr. Madhusudan Asawa, Consultant and Interventional Cardiologist, Head Department of Cardiology, Pune Hospital and Research Center, Pune. Dr. Pushparaj Patel, Senior Interventional Cardiologist and Director at Golden Heart Hospital, Jabalpur. Welcome to the show, doctors. First, I'd like to start with Dr. Ashish Agrawal. In simpler terms, Dr. Agrawal, if you could explain us, what do we mean by high BP?
So high blood pressure is basically, when we talk about high BP and hypertension, these are two different things. High BP can be just an incidental recording. It can be an isolated recording, and that can be related to any kind of emotional or physical stress to your body. But we define hypertension when we have multiple readings of high blood pressure on separate occasions on multiple visits. If your blood pressure is persistently or continuously high, that is called hypertension, and that needs treatment. So it can always be diagnosed by checking your blood pressure by a simple measurement called as a systolic and a diastolic blood pressure. Anybody can check it at home with the automated blood pressure machines also. And if your reading is continuously more than 140 by 90 at rest, then we call it as hypertension. So of course, once you are labeled as hypertension, you should be treated, and most of the patients, they need treatment for the rest of life.
Thank you for bringing out the difference between high BP and hypertension. Dr. Madhusudan, I'd like to come to you next. Why is this called a silent killer?
Nice. So look, actually, this is one of the most important messages we try to get across to patients most of the time, because hypertension, we often call it as a silent killer, because in most people, it doesn't actually cause any noticeable symptoms until it's already done significant damage. You know, you can walk around for years with high blood pressure and feel completely fine. But underneath, it's quietly putting strain on your heart, your blood vessels, your kidneys, and even your brain. And like you said, on your eyes too. Now, what makes this dangerous is that this ongoing stress can lead to very serious consequences like heart attacks, strokes, heart failure, kidney damages, and even vision loss. Often the first sign that someone has hypertension is when they actually present with one of these complications. And that's why we emphasize the importance of regular checkups, which is probably the only way to catch it early. But the good news, like they say, is that many of these are manageable. But again, without symptoms, many people don't think to get it checked. So the term silent killer is just not being dramatic. It's actually reality. And I think that's why awareness, screening, and prevention are absolutely critical when it comes to protecting cardiovascular health.
Right. How common is high BP in India? Dr. Pushparaj Patel, if you can throw light on this.
Yeah. High BP is seen in around 1/3 to 1/4% of population in India. That is around 25 to 30% of adult people, they have hypertension. And it is gradually increasing. And it is not only common in urban population, but also it is equally prevalent in rural population also. And the more alarming thing is that around 60% of the patients who are having hypertension, they are unaware of that disease, and either they are not diagnosed or they are not aware of the disease. And out of those patients who are having hypertension, only 15% of patients, they have the control on the blood pressure, that is good control on the blood pressure with medication or lifestyle modification. Urban lifestyle, poor diet, stress, and the lack of exercise, they are the major contributors for hypertension. And now the prevalence is equally increasing in rural setting also.
Right. Like Dr. Patel said, some things have been enumerated, but Dr. Agrawal, what are the other leading causes that's causing high BP?
So if we talk about the causes of hypertension, we say that 95% of the time hypertension is called essential or primary hypertension. That means it actually has no reason. 5% of the cases can have some reasons, which is called as secondary hypertension. We'll not discuss in detail about the causes. But if we talk about some risk factors, that as we see that I always say that hypertension is a disease of modernization. It's a disease of, you can call it as a taste also. It's a disease of tongue also. So we see that hypertension is more common if you see in the rural areas, the incidence is 10%. If in the urban areas, the incidence is 30%. As Dr. Pushparaj Patel already said that there are some risk factors for hypertension. For example, lack of exercise, rising weight, smoking, alcohol, stress. These are all the risk factors where a patient is more likely to develop hypertension. So I think this urban lifestyle is causing more and more people with hypertension. And the biggest problem is the inertia. That means the unawareness of hypertension in patients. And secondly, even if so many people are aware that they have hypertension, they still have an inertia of taking medicines. They are not able to accept that they probably will need to take medicine for the rest of life.
I think this is a very crucial thing, that there is less acceptance that the medicine has to be taken throughout life for hypertension. When we say that high BP also affects our brain, it becomes a very important, very significant factor. Dr. Madhusudan, could you explain that?
Yeah, of course, high BP can in fact have a very profound impact on the brain. And again, the damage often builds up silently over time, like I discussed earlier in the last question. Now, one of the most serious consequences is the risk of stroke, increased risk of stroke. Now, when your blood pressure is consistently high, what it does puts extra force on the walls of your arteries, including those that supply the brain. So over time, this can cause those vessels of the brain to narrow, to weaken, or even rupture. Now, if a vessel in the brain bursts or gets blocked, it can cut off the blood flow to the part of brain which is supplying, and that's essentially what a stroke is. But it doesn't stop there. The problem is that chronic hypertension is also linked to what we call as cognitive decline and dementia, particularly in medical jargon called as vascular dementia. Now, that happens when the brain doesn't get enough consistent blood flow over a period of time, leading to gradual damage to the brain tissues. Eventually, it starts to show up as memory problems, slowed thinking, and difficulty with tasks. So even conditions, like small vessel disease, what we call in medical language, which affects the tiny arteries deep inside the brain, they are tied again to high blood pressure. Now, this can lead to what's called as silent strokes, where there may not be much obvious symptoms at first, but over time they add and affect the brain function. So I think managing blood pressure is just not about the heart, it's also absolutely about protecting the brain too.
Right. We've talked about the brain. Now let's focus on the kidneys. Dr. Pushparaj, how does high BP affect our kidneys?
See, the function of kidney is to filter the waste products from our blood out of the body. They have small blood vessels, and the blood passes through these blood vessels, and the toxic products, they are filtered from these blood vessels out of in the urine. If the blood pressure is persistently high, these small blood vessels, they get narrowed because of the persistently raised blood pressure, and high blood pressure damages these small blood vessels. It makes harder for the kidney to do its work, and over time this finally leads to chronic kidney disease or renal failure, and a lot of patients, they end up in dialysis. In fact, hypertension is the second most common cause of renal failure in India after diabetes. So it damages kidney a lot.
Right. So that's quite a serious aspect of hypertension, that kidneys have to be protected as well. Coming to eyes, Dr. Ashish, how our eyes are affected by high BP?
So if you talk about damages caused by hypertension, we have to understand that every part of your body, right from head to toe, can be affected by hypertension. It's not an organ-limited disease. It affects the entire body. And if you see, the mechanism actually remains almost same everywhere. You see, your blood vessels are supplying blood to your entire body, and blood vessels are everywhere. If they are subjected to high blood pressure for a long time, that high blood pressure is consistently and they are continuously damaging your blood vessels in every organ. And if it is in the eyes, there is a condition called as a hypertensive retinopathy. That means you have the retina in the backside of your eye. And if it is damaged by hypertension, that is called as hypertensive retinopathy. And it can actually cause vision loss, distorted vision. Simultaneously, it can cause, see, if your blood pressure is high, it can cause bleeding also in any part of the body. It can cause bleeding from your nose, inside your brain, and similarly, it can cause bleeding inside the eye also.
Right. Dr. Madhusudan, when we say a big population of those affected by hypertension are not even, or high BP, are not even aware of this. So are there any warning signs of high BP that, people can take cognizance of?
Yeah, unfortunately, in a nutshell, not much. Look, most of the time, what happens is high blood pressure has no warning signs, and that's what makes it so dangerous. You can feel completely fine, but your heart and blood vessels may be under constant strain. Like last question we discussed, that's why we call it a silent killer. But in some cases, if the blood pressure gets very high, people might notice symptoms like headaches, dizziness, bleeding from the nose, or blurred vision. But these usually don't appear until the condition is very severe, and by then the damage may already be happening. So the truth is that you can't rely on how you feel to know if your blood pressure is high. The only way to find out is to get it checked regularly. It's a quick, painless procedure and can help you avoid serious problems like heart attacks, strokes, or kidney damage, and later on cognitive declines. So one would suggest for a larger population, for the society, not to wait for symptoms. Check your blood pressure. It's one of the simplest steps you can take for your long-term health.
Dr. Pushparaj, when we say that we should check our blood pressure, like it should be for everybody, do you suggest that? How can I know I have high BP? If I'm feeling all right, do you suggest some periodic tests for everybody, irrespective of whether they are feeling good or not?
To diagnose hypertension, the only way is to check the blood pressure. A lot of times it happens, some patients come and their relative, they get their blood pressure checked. Their blood pressure comes to be high and machine is showing wrong reading. I don't have any blood pressure. And then on a few follow-up visits, their blood pressure remains to be high, and then they accept that they are having hypertension. So everyone should have their blood pressure checked either at doctor's clinic or at some health camp or home BP monitor or pharmacy or wherever it is possible. And regular monitoring is very essential, either in form of clinic. Now everyone is, a lot of patients, they are keeping blood pressure machine at home to regularly monitor, home blood pressure monitoring or ambulatory blood pressure monitoring. These can help in diagnosing the exact blood pressure and to adjust the dose of the medicines.
So, Dr. Patel, if one is feeling all right, but for the sake of checking, how often should one check at home with the BP monitors? How often should this checking be done if one was to do it by oneself?
If someone is diagnosed of hypertension, initially when the person is diagnosed with hypertension, they have to check like daily for confirmation of blood pressure. And once he's diagnosed that he's having a hypertension, now he's started on lifestyle modification along with treatment, then around once in a week, they can get their blood pressure checked to see whether the blood pressure is under control or not. And if someone is not having hypertension, just for diagnosing or for screening purpose, once in every 3 months or 6 months, everyone should get their blood pressure checked to see whether they have developed hypertension or not.
Okay, that's a good point. That once in every 3 or 6 months, they should get it checked if you're feeling all right for the sake of screening. Coming to lifestyle changes, Dr. Ashish, how can lifestyle changes help control high BP?
So when we say that hypertension is actually driven by lifestyle and it is partially a disease of lifestyle. So of course, there's a lot of lifestyle changes where we can actually partially control your blood pressure, right? Or at least you can control your blood pressure with less number of medications. It cannot be said that just lifestyle changes can actually cure your blood pressure, but it can contribute to control. So the most important lifestyle changes is the less salt type. Is you have to consume salt, low sodium salt. In fact, some people are actually replacing their salt with this rock salt or black salt, which is not recommended. You have to take normal iodized salt, but it has to be taken in less quantity, and it can be taken as whatever amount of salt you are consuming in your cooking, that can be used. Your added salt, for example, in salads or these pickles, papad, all these salty canned food, packed food, processed food, these are all highly salty food, should be avoided altogether. Secondly, there are, for example, maintaining a healthy weight, going for an exercise, going for a brisk walk, and doing some yoga, meditation, stress management. These are all kind of lifestyle changes where you can actually control your blood pressure with less number of medications. Or if you have a borderline hypertension, that can be halted for some time by these lifestyle changes. Secondly, your diet should be rich in these fruits, vegetable, fiber, your alcohol and smoking. It also increases your blood pressure. So this can be controlled partially by completely stopping these tobacco and alcohol products.
Right. Dr. Madhusudan, a lot of people who are having hypertension and are advised to take BP medicines, they sometimes say we are feeling all right. Why should we take medicines for the entire life? Would you like to talk about that?
Yeah, absolutely. You should be taking your medications. Basically, it's like life in general. Feeling fine doesn't mean your blood pressure is under control. High blood pressure usually doesn't cause symptoms like we have discussed so often now. And so you could feel practically perfectly healthy even when damage is quietly happening inside your body. What actually happens is blood pressure medication works by keeping your numbers in a safe range, which helps protect your heart, brain, kidneys, and blood vessels. Now, if you stop taking it just because you feel okay, your blood pressure can rise again, and that increases the risk of heart attacks, strokes, or other serious complications. Now, just to give you a random analogy, you can think it of like maybe wearing a seat belt in your car. Belt because you're expecting a crash. You wear it because it protects you in case something happens. So I think blood pressure medicine works the same way. So always follow your doctor's instructions even when you feel well, because staying consistent is what keeps you truly healthy. It is disastrous to stop medication just because you're feeling fine. So yes, the answer is yes, you keep continuing taking blood pressure medication even if you're feeling fine. And the key is measurement of blood pressure, like my colleague was saying. Consistent measurements of blood pressure, either home blood pressure monitoring or with your local general practitioners.
Okay. So, Dr. Patel, if one is diagnosed with high BP, we have discussed different aspects of it. What should be the first thing that one should do?
If someone is diagnosed of high BP, as my colleagues Dr. Ashish and Dr. Asawa has already told, they have to start lifestyle modification along with medication. Alone lifestyle modification is not sufficient to control blood pressure. And a lot of times we see that gradually with strict lifestyle modifications, the medicines can later be stopped. But blood pressure or lifestyle diseases are such diseases which cannot be cured permanently. Later in future, sometimes they again require medicine. So they have to like check the blood pressure regularly. They have to visit the doctors regularly and take the treatment as advised, along with the healthy lifestyles. And one of the most important point I feel in lifestyle modification is adequate sleep. That is also very important in controlling blood pressure. That is also a very big risk factor, that lack of adequate sleep. So these are the few things applying which we can stay healthy forever.
Thank you so much, doctors, for a very enlightening discussion on different aspects of high BP. And as we've discussed, it's a silent killer, and everybody should get themselves screened for it periodically. And those who have been diagnosed with high BP need to be careful. They need to follow the doctor's advice and follow a healthier lifestyle to help control it and live a healthier life. Thank you so much for being on the show and sharing so much knowledge and vital aspects of controlling high BP. I'm sure our audience will have very important takeaways from this discussion. Thank you once again.
Thank you.